I encourage you to really reflect on your own experience. We all have loved ones who have struggled or who have known someone with substance use disorder, and this can bring up different feelings within ourselves. You may have your own experience with substance use or recovery, and that's going to impact the way that you interact with your patients or clients. And so, what is really important is to just be curious about what is showing up for you in your body and in that interaction with your client. So, how do you make sure that you're providing a positive space for them and their goals, and for them to decide what's best for them in their lives and us not bring our own agendas because that's really hard? I'll give an example. My brother struggles with substance use disorder. And when I was interacting with a client that was around his age and had similar demographics, it was really overwhelming for me. And I realized that I wasn't showing up as my best self to that patient because it was reminding me so much of the particular. And so I identified, you know what, I might not be the best person to support this patient in their recovery journey. And so we spoke about that and we were able to transfer his care to another provider within our clinic. And he was really grateful when we had the conversation about the why. On the other hand, if you are someone that is in recovery and you're talking to someone in active use who um, wants support around how to use more safely, that might be triggering you in your own recovery. So you want to make sure you're protecting yourself and your recovery and your journey as well, because everyone's recovery is defined by themselves. We can't define recovery for anyone else. So it's important that we are protecting ourselves. It's important that we're being thoughtful of our patients. But most importantly, we want to create a space of positive regard for our patient and really always create a space of compassion, regardless of wherever they are on their spectrum of use, from no use to chaotic use. We want them to always know that they can show up and we're going to, if they show up, we're going to meet them where they are. Knowing that trauma and substance use are so interrelated, we know that those clients are often going to come to us with a lot of trauma response, maybe more reactivity. Maybe they're showing up in chaos after not sleeping for many days. Maybe they come in and feel awful because they're experiencing withdrawal and they need help right now, right this minute. And that's not on your schedule. You don't have the space. And often people in trauma with a trauma history are coming from that fight or flight space. And so, how do we make sure that we are checking our nervous systems, that we are making sure that we are being steady to meet them wherever they are in that space, but to first hear them and hear what they need? And often it is that they're suffering right now and they need help right now. So, how do we make sure that they feel seen and heard and get their needs met and not add to the chaos and add our reactivity to theirs, which can make it a less impactful interaction? So there's a lot of interplay here between trauma and substance use. And I encourage you to delve more deeply into the resources that we provide. This is fascinating topic. And I encourage you to do your own work of exploring yourself and your feelings about recovery and substance use. That way we can better support and show up for our patients and our clients. Thank you.